Attitude is a little thing that makes a big difference. Winston Churchill. Every day, with everything we do, we add to our personal identities. Our personal identities can revolve around what we look like, what we choose to participate in, and how we choose to act. During my time in high school and now in college, I strive to be compassionate and to be a leader. My love for helping and giving back is shown throughout my activities at school. I am currently a part of Indiana University Dance Marathon. This organization spends numerous hours raising money for the amazing children and families of Riley Hospital. Knowing our personal identity is critical to comprehending our professional identity. Right now, we are in the process of developing our personal and professional identities as nurses. Being professional in the workplace is extremely important because we want our patients, fellow nurses, and physicians to be confident in our practices. We must be able to work as a team through interprofessional practice. Having good attitudes and our abilities to work together will correlate to high-quality patient care and less miscommunication. This will lead to a safer and more effective environment of care for our patients. Being an integral part of a team shows both the importance of personal identity and personal communication. Too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. Leo Buscaglia. We as nurses need to constantly make sure that we create an instant rapport with the patients and yet be effective with their time. This is an important task to learn in order for our patients to want to disclose their personal information back to us. We need to be able to listen patiently and use positive verbal cues to make them feel comfortable. It is imperative not to judge and to keep an open mind while communicating with our patients. We must communicate with them in a comforting yet confident tone. Because there are multiple steps that go into patient care, it is important to address not only the patient, but also other healthcare professionals in a clear and assertive manner. While I think it is important to share opinions, it is also important to respect and care for others' thoughts and beliefs. A person can communicate with someone in 3 different manners. They can be passive, assertive, or aggressive. Being passive normally means that a person does not stand up for himself or herself. Being assertive is about being direct, honest, and expressing feelings without the anxiety that it will offend someone else's rights or beliefs. And being aggressive is standing up for yourself. However, it tends to violate the rights of someone else. While I understand that being assertive in situations is very imperative, I have always struggled with doing so. I tend to be passive with my comments and opinions because I try to avoid conflict. Therefore, by using good body language and I statements, I can work on becoming assertive and handling disagreements better. This semester has taught me not only about myself, but about how much there is to learn about being a good nurse. By embracing the quote, "Faith does not make things easy, it makes things possible," I have begun to learn that it is okay to make mistakes. However, I must then learn from them and continue to grow. We have many wonderful opportunities to learn throughout our time here in nursing school. While patient care is rewarding, it also comes with many responsibilities. Therefore, when I need help with something, I will not be afraid to ask or seek out the answer on my own through my professors and/or textbooks. To be successful in this program, I must learn to have good time management, get some sleep, eat a healthy and balanced diet, and remember to reach out to my peers and wonderful professors when I feel overwhelmed. I am excited to continue to grow as a nurse and learn from my many adventures along the way. My future goals as a professional would be to obtain a BSN and an RN. After a couple of years, I would like to get my master's degree and become a nurse practitioner. The area that I would like to go into would be veteran affairs. I believe this field will keep me on my toes and give me the satisfaction of caring for people who have already given so much for us.